Well, good afternoon, everyone, and maybe to some of you, good morning, and welcome to our little webinar here this afternoon. I'm going to call it afternoon because it's afternoon here in Green Bay. The sign in front, if you noticed, was a makeshift sign that came in after the fact. Our sign out by the street is larger, but it has nothing to do with employer services on it. So I, like you, looked at this prospect or this opportunity, if you will, to add these services to my clinic, much like many of you are considering at this time. So it's not as easy as just putting up a sign, but it's certainly the first place to start. As far as offering these services, what it's done for me is allowed us to interface at a greater scale or on a greater scale with business and industry. We always dealt, as chiropractors, we always have to deal with getting our patients one at a time, which can be somewhat arduous and tedious at times because it is work to build a practice. And unlike anything else, if you're able to appeal to the people that are in certain venues like business or industry, you would have an opportunity to gain all of those people under that umbrella and not just an individual at a time. If you're able to sign up a corporation, you now have the opportunity to care for all of them. And I do mean all of them. That can be people in the warehouse, the administrative portion of the business, and even the higher executives as well. So you find yourself rubbing shoulders in places where you wouldn't think you wouldn't necessarily be, especially once you open up a business or get out of school. In fact, I've been at meetings with the mayor in the city of Green Bay. And that was something that I never dreamt that I'd be doing in the work that I do. So offering these services is very valuable. But not only is it valuable to your own clinic, but it's valuable to the marketplace. People are looking for more answers. They're in need of greater answers. They need greater services. And the idea of having just certain facilities, the large hospital-based facilities, for example, offering the services, oftentimes boxes in their thinking with respect to how these services can be performed and delivered. For instance, you cannot obtain a DOT physical in the city of Green Bay on a weekend unless you call a clinic like mine. The hospital systems, of course, just would not offer that. Perhaps that'll change in the future, but to this point, and we've been in it for 7 years now, we just have not seen it. So anyway, those are some of the things that are interesting anyway in looking at these services from a potential standpoint. The things listed in front of you are the different things that we do at our facility, some to a greater degree than others, but to be able to offer many different services keeps all the opportunities at your facility and not necessarily, it doesn't force the employer to go and have to seek elsewhere to find these services to be delivered. If you offer them, you can keep, so to speak, you can keep the money at home. So having more opportunities to solve problems for your employer and their employees just creates greater revenue streams for you. And each of these things, of course, requires a little bit of work, but certainly those can be talked about in more detail in the future. If you want to be exceptional at what you do and you want to serve people to a greater capacity than others in your community, then you have to spend more time than they do at learning the trade and delivering the services. You also have to, it takes a little bit of sacrifice, but the rewards are great. Business and industry has the money, and if you take good care of them, they are more than willing to share it with you. That's why the training that I received actually came from Carol. Carol Jamrose is the Vice President in charge of risk management for 3 different companies under one umbrella. And she has brought me along from me being in my infancy and understanding business cost and how healthcare and workers' compensation costs influence her company and many other companies. She's helped me to understand what decisions that I've made in the past would help or hurt those respective companies. And as providers, I think it's incumbent upon us to understand those rules so that we can provide even greater service and assistance to the companies and help them to save money that's unnecessarily spent. And Carol, in that regard, has taught me how to develop relationships with other people in the community that are business owners and are decision makers for large corporations. You can position yourself with having a greater understanding about what Carol teaches so that you can become a greater authority to those people in the workplace and in the business and industry. You certainly want to be able to talk intelligently when you get in front of these people, because typically you only have one shot. So oftentimes people are like, well, just teach me how to do the testing and the evaluation portion of this, and they want to skip this aspect of it. And I'm offering to you folks that you not make that mistake, because your lack of awareness of what they're talking about is going to take you out of the game immediately in terms of the high-risk dollars that are at stake, and the idea that if you don't understand the nomenclature and how these people are thinking, it's going to damage you and your reputation for being able to get back in there in the future to try to undo the mistakes you've made because of not being aware and not receiving her training. So we spend a little bit of time on talking about Carol's stuff because it's absolutely essential. Private pay patients from occupational medicine services, when you do different things like workers' comp and post-offer physicals and fit for duties and DOT drug screens and DOT physicals, you're going to get the employer to send you those work injuries or work-related injuries at times. But as you all know, if you've been providers in the past, people walk in and they have usually more than one thing going on. Well, that's an opportunity for you to actually parlay them, if you will, into private pay patients if they have other issues. Now, I use the average of 1 in 10 that turn into patients for me, and maybe that average is a little bit smaller. But I don't push too hard, and I will tell you that if you work these services, you won't have to push hard, because people will want to see you as a result of you being in the mix all the time with them anyway. We do a number of different services at our clinic, and we also go on site and treat people. And many times those people are like, I want to come in more than just once a week, or I want to get on top of this a little bit more, or if this requires more attention, I'm willing to come to your office to do it. Well, those are just more and more opportunities that just keep coming through the door. If you are tired of submitting claim forms all the time and having somebody lose them, or if you need to learn a foreign language to be able to understand what they're telling you, or if you if they lose a claim form or don't like your notes, you have people oftentimes with less education than you have making determinations about your reimbursement. Well, this is a way to hedge against that. This is a way to turn away from those types of scenarios so that you can feel like you have choices again with respect to your practice. Feeling trapped is not a lot of fun, and if you just are working from a third-party pay perspective, oftentimes you're pushed into that corner. So I don't particularly care for that anymore, and that's why I'm sinking more of my time into this. We still, incidentally, provide quite a bit of service to people on the major medical side, but more and more of it is growing on the business side, which is a ratio that we certainly enjoy the benefits of achieving. When you set a bill, when you set the pricing with your employer, none of it gets turned into insurance unless it's a work-related injury. The rest of it is a predetermined price. You send a bill, you get paid. It's just like the light bill or the electric company. They send you a bill, you pay it. The big business does the same thing. If they like what you do, they're not going to spend any time haggling over the price on it. They're going to receive the bill and pay it like a light bill, and you will receive the money without having to pay somebody higher dollars to fill out a claim form and then hope that it gets paid and hope that it doesn't get lost and hope all the other things that it doesn't get denied and all the other things that go along with it. So you tend to see the growth in your practice as you begin to expand your services in this regard. You must do it responsibly. I need to add that, because if you just throw your hat in the ring and you just take a haphazard type of approach to this, you will fail, and it may cost you money, because big business doesn't play around. If you hurt them, they're going to look to find some remedy with respect to that. And I've never had any of that happen. All I know is that if we're conscientious and we work hard to serve these people well, then we have a great opportunity for continued growth. These people go to meetings with other people. They go to seminars with other people, and they talk to other people that are your potential new clients. So you're always in the limelight, so to speak, and you're always under the microscope. Activities that you perform in the employer services world are activities that are seen by other people. So every choice you make, every piece of paper you fill out, someone else is going to get to see besides that particular person or patient. And unlike being in a treatment room where you can say or do just about whatever you want within the law and record it on paper as being so, now you have other people looking at your work. So you must be good at what you do, or you will wind up losing those accounts or making more trouble for yourself than you need. Last year we did, this is some of our numbers, these are some of our numbers. I don't know how Mary charmed these from me. I don't know, I think she's going to owe me a case of wine or something. But anyway, here's what we did last year. And typically you don't get clinics sharing these kind of numbers with you guys, but I would like you to appreciate the fact that this could be you. And you could do it better than I do. I don't have any corner on the market with respect to how great we do these things, but just think of the possibilities. There's a lot of money in business and industry, and you being reimbursed at a third-party reimbursement managed care rate is nowhere near what's available to you. Last year we performed 155 of these post offers, and our average pay on them was $206.45. So many of you say, well, what is the actual price you charge for it? Well, that depends on what the client demands, what their needs are, and how you can build something that they trust you are doing the best thing for them to assist them with their growth and protect their assets and reduce their liabilities. Physicals are fee-for-service, and those are non-DOT because there are many companies that want to do some sort of physical with their employee, and it wouldn't necessarily have to be a fit-for-duty evaluation versus like utilizing JTech equipment. It might just be a physical, or it's a combination of both. And we get $60 for those, and those typically take maybe 15-20 minutes max. DOT physicals are also the same thing, but only they're under the jurisdiction of the Department of Transportation, and the Federal Motor Carrier Safety Administration is one arm of the DOT, which is the trucking industry, and we get it on average about $59 for those. And the face-to-face time that a clinician would have with an individual who is in for a DOT physical would be about 15 minutes. Now with the NRCME, which is the National Registry of Certified Medical Examiners, coming out with rules and regulations that say that if you want to perform these physicals, you must be trained and certified by May 21st, 2014. That means you have to go through at least a 12-hour course training you on the rules and regulations of the DOT physical, and then you must pass the test that all doctors and nurse practitioners, DOs, let's see, it would be MDs, DOs, nurse practitioners, chiropractors, and, oh, I'm forgetting one, I believe, have to pass this examination. We all have to take the same test to pass the examination. That is going to take the number of providers from approximately 260,000 providers doing these tests and physicals across America right now to approximately 60,000 by May 21st, 2014. If that's the case, well then that $59 charge is going to climb. Like it or not, that number is going to go up. For the provider, it would be a good prospect, a good opportunity. Last year we provided $43,622 of 253 hours of on-site services. I have a physical therapist that goes on-site for 4 hours a week. I go on-site at a printing company for 4 hours a week, and I also have a occupational health nurse that goes on-site at various locations. We have 10 different locations where we're on-site, either any one of us or a combination thereof. And it's totaled to 253 hours. So we're coming out at approximately $172.42 for our hourly rate. And oftentimes they're going to ask you to stay and answer other questions. You may have a meeting you have to go to. On one particular with one particular client, we meet with their work comp carrier and their risk management people. And I've sat there and looked at some of the claims, scratching my head why some of the cases are still open. And it's been opportunities for me to get at some of their other costs that occurred even before I got there. So having this kind of experience is going to give you insight that's going to make you invaluable in the eyes of your client. Drug screens were $49.77, almost 5,000 drug screens last year. and we make about $22.73 on average of the drug screens. Some of those drug screens we provide ourselves to the companies that we contract with. Others we're purely just a collection site where other companies have contracted with big stores, for instance, like Walmart, and they have a national contract. They call us and say, hey, can you take care of the Walmarts in Green Bay? And we say, sure. And they say, okay, all you do is collect it and put it in a bag and sign all the paperwork. It's called a chain of custody form. Package is up, and we'll give you $10 to $15. Some places give you $20. So it just varies with respect to that. But this is a good way to train auxiliary staff, and when they're not entirely busy, they're still able to, produce some revenue for you, and you're not just sitting there losing money if there's not somebody coming through the front door. Other things that occur are blood draws for instance, for health risk assessment programs. Some companies want to do health risk assessments. Many companies want to know if their people are smoking cigarettes, because if they're smokers, they're going to pay a higher insurance premium monthly than somebody who does not smoke. And they want to check it, so we go on site and we'll do, last time was 180 blood draws. And of course, then you can set the prices for the lab and the blood draws, and that becomes a revenue stream as well. So let's go on to the next one. That's what I did last year, approximately in employer services, and that does not include the workers' compensation treatment portion of what we do. We're not a heavy treating chiropractic office where we have to see every patient at least 80 times. We try to see 80 people one time, and our average rate of work comp, as far as visits are concerned, is somewhere between 1 and 2 visits. And if you folks get into Carol's seminar, she'll be able to tell you a little bit more about that as well. All right, Mary, let's go on to the next one. Let's see. All right, so when we go on site and we're evaluating people there, we're actually able to make determinations as to what kind of an office visit it is, also determination as to whether it's work-related or not work-related, and also to head off those potential work-related issues before they become one. That's your greatest benefit that you offer the company. In one particular quarter, we billed out $4,000 for the time I was on site at that particular place, and we had computed that it saved them somewhere around $8,000, or in other words, it would have cost them $12,144 if they would have sent it out. Now, we're pretty conservative by nature, so we may not have ordered MRIs or CT scans or some of the other things that are done at other facilities. But literature just recently has been released that shows that if you have somebody go out of the clinic and into a facility, the chances are, and you don't have any type of relationship with them, the chances are that a number of different diagnostic procedures are going to be done, and a number of different office visits are going to be generated to put you through the roof with respect to those costs. So we track these kinds of things, and if you're serious about doing these kinds of services or providing these services to the employer, then obviously it would be imperative that you track your expenses so that you can demonstrate your worth to the employer, because they understand dollars and cents. They don't have much time for anything else. And if you're able to drop their bottom line, it won't make any difference whether you're a chiro or an OT or a PT. You'll be able to attack these issues and get them straightened away, and you become incredibly valuable to the people that you are serving. So, Mary, I hope.
Well, thank you, Brad. You did just fine. Okay, so we have some questions submitted in advance, and I'm going to work on those questions. But again, feel free to use the chat button down on the bottom of your screen to send any questions that you can think of, or to direct us to a question you have about a previous part in the presentation. So the first question that came in, Brad, was, since you started your employer services program, what one thing would you do differently if you were to start it from scratch all over again?
Well, I would be very critical and particular of who I would put into certain places. For instance, if you're going to be providing drug screens, you're going to need somebody that's in charge of that. And you can't do it all yourself. I mean, you can start off that way if you choose to as a clinician, but you can't be the chief, the dish and the bottle washer all at the same time, or dish and bottle washer all at the same time. So you do have to select people that are going to be stable and reliable and conscientious and trainable, and those that are willing to learn. And I sure would have the right person involved with using the JTEC system when the evaluation process begins for post-offers, fit for duties, and work comp treatment. You know, some people are not real computer savvy or real comfortable dealing with gadgets and you know, different pieces of instrumentations like the JTEC equipment. I found it to be quite attractive and a lot of fun to work with. And in working with my patients, I was able to explain to them just how well this equipment helps us and helps them when treating them. So those are some of the things I would consider.
Second question, and one came in by chat that's similar to this. How many professionals do you currently have in your clinic, and how many did you start with?
Well, I started with a medical doctor and myself, and we worked to get a physical therapist in here, but that took a little bit of time. But we were able to get one as we went along. But I primarily handled all the employer services aspect of it until I had a better understanding of it, and then I started to delegate out different responsibilities. For instance, to a physical therapist assistant helps me with the JTEC equipment. That could be an OTA, for instance. It could be an exercise physiologist. Anyone that has a general understanding of human anatomy and physiology and understands how to interface this equipment with an individual. So that's how we started. And right now, I would say that the primary people that are involved with post-offers would be my front desk, who obtain vital signs, height, weight, blood pressure. They do a vision test and a color vision test, and pick up just a few more pieces of information from the individual. And then it's myself or Dr. Nystrom, he's a chiropractor as well, that will do the physical portion of the evaluation. And then the JTEC portion, or the functional assessment of the individual by obtaining this objective data through JTEC, is done by a physical therapist assistant, sometimes a physical therapist, and more than once or twice a month I get in there and do it myself just to stay sharp with the equipment and being able to make sure that we are assessing people properly.
All right. So what would you not do differently that helped you succeed that you would recommend to everyone?
The first thing I would not do differently was I would never give up my ability to talk with Carol and also my ability to be trained by her. She has been very instrumental in the growth of my clinic in so many different ways, and the knowledge that's imparted to me as a result of my relationship with her has helped me not only gain more business, but it helps me to sustain the business that I have because of the knowledge of what she has taught with respect to how business and industry, HR, and safety look at people like myself and look at the services that we offer. I would also make sure that I continue with being a part of the occupational health blog that's on the internet, because there is stuff in there daily by occupational health providers that I read that is helpful to keep me abreast of what's going on in the occupational health world. Some of it applies to what we do, some of it does not. And also to make sure that I continue to read the papers in some of the published journals. The Journal of Occupational and Environmental Medicine is a great journal to obtain articles from as well.
Okay, great. What type of professionals do you have in the clinic, and how much time is required for each in your employer services program on a daily basis?
Well, it varies based on what the situation is. You know, we have a medical doctor here with us, and a nurse practitioner comes in on Thursdays. If somebody needs stitches, obviously that's beyond my scope, and there's always a scope question. I know some of you out there may have questions with respect to scope and what you can and cannot do, and I would advise you to check with your state laws relative to the rules and regs, you know, with respect to that question. However, it depends on the circumstance. 90+%, 99% of work-related injuries are musculoskeletal, neuromusculoskeletal in nature, so that's right up our alley. And we're able to employ not only the chiropractic portion of it, but if somebody needs pain medication or anti-inflammatory medication, they certainly can achieve getting that from our medical providers. Oftentimes we'll try to get them to use something like ibuprofen just to keep it off of an OSHA recordable if it's at all possible. And that terminology, of course, would be something you'd have to learn from Carol. And then if in the unfortunate event that they do need care, we get them into active care almost immediately, if not sooner, because of the value of getting people moving and treating them and having them return to work on the same day that they're injured is oftentimes what we look to achieve.
Okay, what are the top features and benefits that your program offers to employers that helps you sell your services to them?
Well, I think one of the greatest things that we offer and would account for most of our growth is our respondability. We provide service 24/7. We have a live answering service, and we will respond to a client. Some of our clients work round the clock. We will respond to them 24 hours a day, 7 days a week. That is in lieu of them going to the emergency department at a hospital where costs aren't necessarily contained or are really one of the things that are contemplated when different evaluations and decisions are made medically. If somebody needs an MRI or a CT scan, don't get me wrong, they will go. But oftentimes, if we can get the job done without engaging in those services, we attempt to do so. So our respondability and service, like DOTs on Saturdays, staying late, getting up early, seeing their people in the middle of the night, are all opportunities for us. They're not burdens to us whatsoever. By being able to adapt our clinic to the needs of the individual and to the individual client is very important too. We are KX certified in hearing, so we've purchased a hearing instrument that we are able to provide OSHA quality hearing tests for these people as well. And we've done a number of different ancillary things like respiratory fit testing and EKGs, spirometries, things that you would find in a clinic like an occupational health clinic. So being able to respond to the demands of your people is very important as well. And then finally, I think one of the most important things to do is to pay for the training so that your people don't make mistakes. If you make a lot of mistakes, people don't always complain to you, they just disappear. And we can't afford to have them disappear, so I pay dearly to have my people trained properly so that they collect properly as far as urine is concerned, that they know all the rules and regulations with respect to that and beyond. Also for breath alcohol testing, that they know all the rules and regulations of that. We are certified in both. I am certified in both. Also, my medical providers, my medical doctor, and my other chiropractor and myself, I pay to have us trained in the NRCME training program so that we can continue to provide these services, but also because of the knowledge that we gain as a result of going through the schooling has been fantastic. So there's been many things that we have learned along the way as well.
Okay, we only have a few minutes left, so let's try to get to as many of these questions as we can. Were there hidden benefits to your clinic that you had not expected?
Well, one of the greatest things that we realized is that we were able to turn around after we learned the ropes, so to speak, and offer this to other clients. And now we personally serve probably close to 50 clients. And I have a meeting, I actually have to go on site in a half an hour and spend 2 hours on site at one client. And I have a meeting after that to pick up a prospective new client. And this just goes on over and over and over again. It happens almost weekly.
Okay, this is an important one. How is the billing done in terms of insurance rates? Do we bill one rate and then discount it, or do we bill a set contractual amount that varies with each company we partner with? We are asking this in terms of a potential audit by the State Department of Insurance.
Well, I think you have to understand with your respective state what exactly is on the table in terms of insurance and what is private services to that company. Like if you were to cut their lawn and blow their snow or trim their trees, those are things that are outside the purview of insurance. Just like what we're doing in terms of post offers and DOT physicals and non-DOT physicals and drug testing, that is outside the purview of what insurance pays for, and whatever the market will bear in terms of the dollars that you ask is what you should try to get. We have a number of different clients, and we are rather aggressive with our pricing in order to get the business that we can. Obviously, we have to make sure we protect our margin, but if we're able to obtain business, we will be competitive with the pricing, I can assure you.
Okay. If a clinic now employs, yep.
Just to follow up, any stuff that's sent to the insurance company with respect to workers' comp is based on usual, reasonable, and customary rates. That has been the standard in the CPT billing and the CPT billing in the insurance industry for the past several years. So we get whatever we can with respect to that, but there's only one rate, for examining injured workers and treating injured workers and whatnot. That's just a standard. Those are standard fees that are done through the work comp carrier.
Okay, all right. If a clinic now employs therapists and they land an account needing DOT physicals, how would you suggest they handle those DOT physicals without hiring a full-time doctor to perform them?
Well, this would have to be done on a case-by-case basis. You would have to see what the need is, and then see if there's somebody that's amenable to the idea that you could send people to them or have them come in for a day or two a week. You could do it that way. You could certainly hire somebody for a day or two a week. That's how I did it. I had a nurse practitioner work for me 3 days a week, and she learned these different evaluations and assisted us with any work comp that needed any medication or what have you. So it just depends on the application.
Okay. Well, to stay on time, we're just a little bit over, but we'll ask a couple more questions and then we will adjourn. What are the rules for drug and alcohol screens in terms of how the restroom must be set up? Would it be beneficial to have a small separate place just for drug screens?
Well, you have to set space aside for the drug screening because you can't have public traffic and drug screening going on in the same bathroom. It just doesn't work very well. There are specific rules by the Drug and Alcohol Testing Industry Association, otherwise known as DAISHA, that tells you exactly how to set up a bathroom. For instance, you have to have the water shut off or taped. You could tape the water. You have to tape the little flusher handle. You have to tape that. You have to put signage up. There's specific rules. And that question can be answered through other seminars or other schooling as well.
Okay, great. Since you're already performing DOT physicals, how will you prepare yourself for the federal DOT certification that will be mandatory next year?
Okay, I had mentioned that before. I definitely am taking the training right now. It's online. There's a gentleman by the name of Clinton Smith who sat on the board for the National Registry of Certified Medical Examiners, and he has created a program of, I believe it's close to 30 different modules to go through that DOT testing, and then he has quizzes after each module, and then he has a study guide and a pool of questions and a number of different things to help get through this program. I'm halfway through it right now, and I intend to finish within the next 2 weeks and write my test within the next month.
Okay, great. And for those of you who are interested in that, Dr. Kenny uses our employer services software module to do his DOT physicals. So they're very automated, and we'd be happy to show you that software online. The other thing I will say before we adjourn is that we did have a couple more questions, just a couple of more. So what I'll do is make sure that those get answered by email with Dr. Kenny. I would like to thank him very much for his time today. I know he has to head out to an employer account. For those of you who had not heard the numbers, we will be posting this webinar online. Dr. Kenny's accounts right now number over 200 different employers coming to utilize the services of his clinic in Green Bay. So again, Dr. Brad, thank you so much. And